Hi, I'm Dr. Joel Wallach, and today we're going to talk about osteoporosis and arthritis. Many people like to separate them, but in reality you can't talk about arthritis and osteoporosis separately because arthritis is one of the manifestations of osteoporosis. Now, interestingly enough, there's not a single medical treatment designed to prevent or cure arthritis or osteoporosis. We have, in fact, learned how to prevent and cure arthritis and osteoporosis in animals over 300 years ago. And the advantage I have, of course, is I'm a veterinarian as well as a physician. Now, osteoporosis, and I'm going to speak about osteoporosis generically because, again, there's 147 different diseases that are really manifestations of osteoporosis. A medical doctor will normally refer you to different specialists. For instance, if you have a peripheral neuropathy because of osteoporosis in the skull, there's 24 bones in the skull, face, and jaw, and they get osteoporosis just like your ribs and your vertebrae and your hips and your legs. Most people don't realize that the skull bones will get osteoporosis and arthritis too because they have all the joints. And the osteoporosis and arthritis of the skull will actually generate a connective tissue called bone matrix. And this purpose of the bone matrix connective tissue is to attract more minerals into the bones. And it becomes very, very highly produced. It is generated in such large amounts that it fills the canals and the tunnels that nerves go through. And so a lot of diseases we think of as being neurological problems, such as Bell's palsy, where one side of the face droops, that's because the seventh cranial nerve is being squeezed by this connective tissue, this bone matrix that is generated when you have osteoporosis of the skull bones. And then there's trigeminal neuralgia, or tic douloureux. The fifth cranial nerve becomes squeezed. A lot of people will get what's called tinnitus, or ringing in the ears. The auditory branch of the eighth cranial nerve is being squeezed by this connective tissue that's generated when you have osteoporosis. You can get diseases such as sciatica, where the roots of the sciatic nerve, which come out from between the vertebrae and the lumbar area, the lower back, they will actually be squeezed coming out from between these lumbar vertebrae. You can have degenerative disc disease, which is a concurrent or similar disease to osteoporosis, but you can get a shrinking of the vertebrae or compression fractures of the vertebrae, bone spurs, calcium deposits, all of which can impinge upon these nerves. And so we're going to talk about some of these peripheral neuropathies. We're going to talk about osteoporosis. Osteoporosis is not a woman's disease, as doctors would have you believe. Osteoporosis occurs equally. Osteoporosis occurs equally in both men and women. And this will flabbergast most people because most people have been taught that osteoporosis primarily occurs in postmenopausal women. You can have osteoporosis when you're 3 years old if you live on nothing but juice, and a lot of kids do today. They grow up on apple juice and grape juice, soft drinks, dry cereals, hot cereals, very little protein, very little in the way of minerals, and it's amazing that we have so many tall kids because of the lack of minerals. Now, our bones consist of more than just calcium, and when people try to prevent calcium deficiencies with just calcium, they say, oh my goodness, my whole family of women has osteoporosis, so people will naturally gravitate towards supplementing with calcium. Well, that's not enough. There's actually 89 cofactors necessary for the calcium to work and be employed by the body in an optimal way. Many of them the average person knows. People know that you need vitamin D to absorb calcium and deposit in the bones. People know that we need vitamin C to make good and healthy bones, otherwise you get scurvy and you start getting osteoporosis of the facial bones. When you get osteoporosis of the facial bones and the jaw bones, you get periodontal disease. And of course, somebody would refer you to a periodontist or a dentist, when in fact you need to deal with the osteoporosis that is caused by the vitamin C deficiency. So you need vitamin D, you need vitamin C, you need vitamin A to have healthy bones. You need copper and zinc and selenium and strontium, and you need boron. You need things like silica, praseodymium, neodymium, and I could go on through the 60 essential minerals, and then all the vitamins are necessary for your bones to maintain and repair themselves, to develop bones when you're a child. And so it's a very, very naive position to take if you want to prevent osteoporosis to just supplement with calcium. I also find it kind of amusing that the modern physician today, when somebody complains about achy bones and he does a bone density test and finds that they do have early stages or even advanced stages of osteoporosis, instead of sitting down and talking with them for 15 minutes about mineral supplementation or all the known essential nutrients, they will whip out the prescription pad and write a prescription for drugs such as Fosamax. And certainly Fosamax does not rebuild bone mass. It will slow down the teardown process, but will not actually add more bone mass. People also forget that there's a two-edged process going on in our bones at all times. Our bones are not static. They are not like poured concrete. Our bones are very dynamic, depending on what you eat and what you don't eat. That's why people with arthritis, they say, you know, I get achy sometimes, and then I could go weeks and not get achy, and then, man, suddenly I get very achy. Well, that's because of what people are eating and not eating. And so, obviously, you want to consistently supplement with all the known essential nutrients, stay away from the bad stuff. And in the case of bones, the bad stuff starts with a list of carbonated drinks. Carbonated drinks actually neutralize stomach acid. And you cannot absorb, or you cannot efficiently absorb, minerals without stomach acid. You cannot digest protein because the stomach pepsin, the stomach enzyme known as pepsin, cannot work properly in a neutral or an alkaline environment. It must have a very acid environment. You cannot absorb vitamin B12 without stomach acid. So these kids and adults who consume numerous soft drinks each day, even the diet ones, or things like ginger ale, maybe club soda, seltzer water, or the carbonated waters such as Pellegrino water, Perrier water. All of these will neutralize stomach acid, and for first aid for heartburn it might be okay, but drinking 3 and 4 and 5 of these a day, drinking them with each meal, or even drinking them when you're supplementing with minerals is really a self-defeating activity. So you need to stay away from the carbonated drinks. I cannot stress that enough. When it comes to caffeine, there's some good things about coffee and tea. Again, they have some antioxidants in them. They also, because of these antioxidants, can reduce the risk of certain diseases, such as cancer and heart disease. Coffee also has phytonutrients in there, which can be good for asthmatics, because it'll actually dilate the passageways in the lungs, the bronchi and the trachea. However, because of the caffeine in coffee and black teas, it actually dumps minerals. After you absorb them, you're going to dump them because, of course, the caffeine is a diuretic, makes you sweat more, makes you urinate more, and as you sweat and urinate, you lose more minerals. And so these are all things that are very, very important to know if you want to avoid osteoporosis and arthritis, or the peripheral neuropathies, or the 147 different diseases you can get if you have multiple nutritional deficiencies, including calcium and sulfur and so on, things that are necessary for healthy bones. Some of the common diseases that occur in children when they have a calcium deficiency plus varying deficiencies of these other 89 cofactors include growing pains. And doctors will very naively say, look, the kid's got growing pains, I'll outgrow it. The parents need to jump on this. This is a signal that they're severely minerally deficient. Their growth rate, because of energy and protein intake, is outstripping the amount of minerals they have available to them, and is causing pain in the bones and the joints. And these are kids who are going to have dental problems. These are kids who are going to have joint problems later in life if you don't deal with it then. Then when you get teenagers, they can get what's called Osgood-Schlatter disease. This is osteoporosis of the crest of the tibia, which is that sharp edge of the lower leg bone just below the knee. And as they even walk or maybe run or do athletics, it's very, very, very painful. It's called Osgood-Schlatter disease, and it's simply reversed. Doctors will say, well, you got to stop playing sports. Oh, you don't need to stop playing sports, but you do need to supplement and get off the carbonated drinks, which is a common mistake of teenagers and young adults, or maybe even golfers. If they have pain in their shoulders, this sort of thing, the pain in the shoulder is something that you can totally avoid by supplementing properly with all the known essential minerals, all the known essential nutrients. Another mistake that people make is eating high-fiber diets. High-fiber diets contain a substance called phytates. Phytates are found in raw vegetables like carrots, things that snap, raw carrots, raw celery, broccoli that snaps. Also in bran and grains, whole grains, this hard covering contains a substance called phytates. These phytates will bind onto the minerals that are in your food, and the minerals that are in your food will bind with these phytates and form a phytate mineral combination or complex that you cannot absorb. So you can be supplementing very heavily, and if you're eating bran muffins for breakfast and multigrain breads on your sandwiches, and you're eating raw vegetables for lunch and dinner as a salad, you're still going to wind up getting mineral deficiency diseases, including osteoporosis and arthritis. Now, some of the earliest signals, whether it's a child or a middle-aged person or an adult, some of the earliest symptoms of a calcium deficiency and sort of a warning that you're going to wind up with osteoporosis and arthritis is the eyelid twitches, toe cramps, foot cramps, leg cramps, back muscle spasms, insomnia. These are all signals that you have a calcium deficiency and multiple cofactor deficiencies necessary for the calcium to work properly. Even if you see somebody come to the office with toilet paper all over their face because when they shave that morning, the blood just doesn't clot. It just sort of oozes all day. Your blood should clot within a minute. And if it just oozes and oozes and oozes and you can't leave the house without putting little squares of toilet paper in your face, that means you don't have enough calcium for the clotting mechanism to work properly. If you don't deal with this at that time, the next thing that happens is you get high blood pressure. Most high blood pressure is directly related to a calcium deficiency. And we know this because we've eliminated diseases like high blood pressure and osteoporosis and arthritis in animals with simple mineral supplementation in these little food pellets. And again, we'll talk about them later, but these little food pellets contain all the known essential nutrients. They're not just alfalfa pellets. And by using this little technique, we have eliminated osteoporosis and arthritis over 300 years ago in animals. And it's always amazing to me that it's impossible. I've tried for 25 years, so I know it's impossible to get physicians interested in preventing and curing diseases with nutrition like we did in animals. We don't have insurance for animals, so we have to deal with these problems in a very effective way, very cost-effective way, and we do it with nutritional supplementation. Now, some of the other diseases that are caused by osteoporosis are kidney stones. And a lot of people say, well, wait a minute, my doctor told me that I have to get off of calcium. I'm taking in too much calcium, so I have kidney stones. No, you have kidney stones because you have raging osteoporosis, which tells your parathyroid glands, not your thyroid glands. The parathyroid glands are responsible for releasing a hormone called parathyroid, which increases the body's ability to absorb more calcium and also helps the blood calcium get deposited in the bones. Well, if there's no calcium in your diet or very little calcium in your diet, what happens is the parathyroid goes to the bones and says, hey, the body's calling for more calcium, so we're going to take it from the bone storehouses and so we can keep up the blood calcium in the blood. And oftentimes the parathyroid glands are so hyperactive over this that they actually get the blood calcium very, very high. And this, unfortunately, makes medical doctors nervous. This makes medical doctors nervous, and they want to surgically remove the parathyroid glands to lower the calcium. When in reality, all you have to do is take in not only calcium, but also all the other 89 cofactors, and that way the blood calcium drops down into the normal level. The hyperactive parathyroid glands will become quiet again, and you will be able to function properly. But kidney stones are not caused by too much calcium in your diet. It's from raging osteoporosis. The same thing is true with bone spurs and calcium deposits. They always occur, always, 100% of the time, occur where a tendon or a ligament hooks into the bone. That's why we have heel spurs and calcium deposits on the heels in the exact same place all the time. On the top of the heel where the Achilles tendon hooks in, and on the bottom of the heel where the plantar fascia on the bottom of the foot plugs into the bottom of the heel. And these are signals. Also, as people get older, usually after they graduate high school, they begin to shrink. Shrinking in height is a signal that you already have osteoporosis, even if you're only 18 years old. you're going, and I've seen people who've shrunk 4 inches, 6 inches, 8 inches, and their ribs actually will fall down over their pelvis because they've shrunk so much. They don't get compression fractures, just everything reduces in size because they don't have enough minerals to sustain the proper architecture. You can get compression fractures. You get life-threatening fractures of the hips and the leg bones. When you do that, of course, these are massive mineral deficiencies, and when you get bone-to-bone arthritis of the knees and the hips or the shoulders, doctors want to go in and put in artificial joints. They want to do arthroscopic surgery of those joints. That's how they make their living. However, if you just supplement properly and avoid the bad stuff, and again, in the case of osteoporosis and arthritis, the actual cause is a deficiency of not only calcium, but the other 89 cofactors, which includes 59 other minerals. And so it's a little more complex than supplementing with calcium. It's considerably more complex than just supplementing with a drug, Fosamax or any of the others. I find it interesting that doctors, after going to school for 14 years, forget the physiology of the body. And they start talking about healing the body. And we do need these minerals. Where did people get these minerals? Where did people get these minerals thousands of years ago? Well, they got them from their wood ashes. The wood ashes, of course, were the byproduct of daily living, even before written history. Thousands of years before the time of Moses, there were wood ashes. Wood ashes are the byproduct of using wood for fuel, which is the common fuel and back then and even today. In the actual third world countries, wood is still the primary fuel. The wood ashes are the minerals that are left when you burn away the carbon in the fuel. And when you burn away the carbon in the fuel, you have these ashes left over. They mix them in their garden as fertilizer. They can actually mix them with compost or manure because the manure and compost doesn't have much in the way of minerals. A lot of organic material, but not minerals. Minerals are still required separately to be put into the gardens and the fields. And if they're not being put in anymore, which they're not, then we have to consciously supplement with them. Dowager's hump is another terrible complication of osteoporosis. And I see literally hundreds of women who will come to me and they'll say, well, why do I have Dowager's hump? Why did I shrink 4 inches? Why am I all gnarled up with arthritis? My doctor said my calcium is perfect. And of course, that's because the doctor just tested the blood and said, look, the blood calcium is normal. We don't need to add any more calcium to your diet. Well, those doctors really have committed a great sin because your body has a mechanism called the homeostatic mechanism. And the body will maintain the calcium at the proper level even though you have raging osteoporosis. And when you have raging osteoporosis, you're still going to have either normal blood calcium levels or elevated blood calcium levels because the parathyroids get excited and they pull more calcium out of the bones. And where you have the tendons and ligaments hooking in, they pull on softer bones. Bones, when you have osteoporosis, are not brittle. They're actually soft, and you get folding fractures and compression fractures. And it's a little different than is described actually by doctors. And so these tendons and ligaments will pull on these bones and create a little lump. And if it's amorphous or nondescript, they'll call it a calcium deposit. If it's sharp and pointed, they'll call it a bone spur, but the actual cause is the same. And you can actually eliminate them by supplementing properly with calcium and all the other cofactors. You can eliminate bone spurs and calcium deposits, arthritis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, osteoporosis, and almost all of the peripheral neuropathies associated with osteoporosis and arthritis, periodontal disease, insomnia, hypertension, all the diseases that actually are either directly or indirectly caused by osteoporosis. We can eliminate them with proper supplementation, all the known essential nutrients, especially the 60 essential minerals, and by eliminating the bad stuff. And the top of the list, the bad boy, when it comes to bone health, are the carbonated drinks, even the diet drinks. And there was a wonderful study. It's called the Harvard Nurses Health Study. 91,000 nurses, and they found out that if you drank non-cola carbonated drinks, you could actually increase your risk of fractures and osteoporosis by something like 300%. This was a 20-year study of 91,000 nurses over the age of 35. If you drank cola-carbonated drinks, you increase your risk of fractures and osteoporosis by as much as 500%. Then they went back and they did a study on 9th and 10th graders. And this was out of Boston schools. And they found out that they could actually eliminate fractures and osteoporosis in teenagers by eliminating the consumption of these soft drinks, carbonated drinks, ginger ale, sodas, diet sodas. Remember the carbonated ones, whether it's Pellegrino water, Perrier water, and the worst of the worst were the carbonated cola drinks. These are the worst of the worst. Now, if you do all this, you can live to be 100. You can live to be 100 in a very healthful way without osteoporosis and arthritis. Osteoporosis and arthritis is not genetic. They're not genetic. Osteoporosis and arthritis are not something that people and human beings are destined to get. I've treated people who are 97 years old, and I've met many hundreds of them who are over that age. And let me tell you that there's no need to get osteoporosis and arthritis. We know from people who live in the third world countries that you can live to be well beyond 100 without getting osteoporosis and arthritis. It's not a genetic disease. It's not an old disease. It's not an old person's disease. It's actually a disease of mineral deficiencies. If we consciously put in the minerals, get rid of the bad stuff, no osteoporosis, no arthritis. It's that simple. And I get excited about it. I get so excited, and I hope you take this to heart. I hope you do these things, and you will be blessed in many, many ways, even beyond your ability to look. Thank you very much.